from South Africa to Nepal. It would be very exciting to hear your views on what the biggest political challenges are and how you see opportunities of tackling these core health systems quality challenges.
Thank you, Miriam. Thank you very much. Let me first congratulate Margaret for your wonderful leadership. So proud and happy to be part of this team. Nepal's new constitution has guaranteed basic health right as a fundamental right. And to ensure this right, we are in the process of formulating a number of laws, Right to Health, Public Health Act. We have just passed National Health Insurance Bill from Parliament and in the process of revising a number of policy and existing laws. However, it doesn't mean that quality health system has now become a primary political agenda. This commission report suggests that one of the metrics which we can use to gauge the quality of health system in any country is to see whether the policymakers, head of the state, head of the government is using the existing health system or not. In our case, our policymakers receiving healthcare in developed countries is considered as norm. It not only shows the lack of trust in the existing system, but also the lack of accountability. However, this is not the end of the story. There is a new trend, and I see an opportunity there. The recent incident in Nepal of a very powerful citizen movement led by a satyagrahi, which was able to garner a huge public support. And the demand was to amend the medical education bill, and that forces all the political parties, the government, to make the necessary amendment. And there is now demand that it has to make it mandatory for all the policymakers to seek medical services within Nepal. And I'm leading this cause in Parliament to amend a new bill. So, I mean, if it can be expected that with a slight push in igniting demand, I mean, we can force policymakers to agree on national goal and to make it a national priority agenda. And my second point be, our health system has primarily developed against a backdrop of multiple donors vertical programs. And it looks like a fragmented patch of disease-centered vertical programs and not giving adequate focus to overall strengthening of the system. This model is undermining not only the capacity of the government, but also the responsibility of the government. I think time has come that government to switch from a role of mere service provider to role of a service provider plus a robust governing agency. That's why I believe the government is called government, not providement. I mean, its primary role is to govern. And you rightly pointed out, sir, that our system is also dominated by the private service providers. So, and when can be an appropriate time? When Nepal is transitioning into federal system, we are defining the roles of all levels of the government. There is our aspiration for universal health coverage, and there is a demand. And that is a very powerful demand. I think this is a very right time, to accept the challenge and to go for new innovations. And my final point would be, to realize this high quality, we need adequate resources. And resources, of course, is quite low. And the budget, in fact, the government budget is declining. So the obvious solution would be to reverse this declining trend of government budget and also do not take it as a shared priority. However, I think the optimal and innovative use of scarce resources is also as good as adding resources. With now most of the resources going to local government, if we can help the local leaders, we have 753 local governments. So if we can help local leaders to visualize and realize that high quality health system is a foundation to a productive population, and your constituents value it, they will acknowledge it, you're going to get more votes. I mean, I'm sure they will allot more resources. And also, I mean, we can use, or I mean, we can leverage the scale of economy as we can, if we can. I mean, there are a number of examples in our region, Sri Lanka, or I mean, I talked that too when I was health minister. I brought that issue with the Indian health minister. If we can enter into kind of inter-country, I mean, a sort of partnership to procure the drugs, we can have, I mean, quality drugs in a very reduced price. So also public-private partnership. I mean, there are a number of existing models. We can customize it. So I mean, the point I'm trying to make is that not only yearn for resources, I mean, make optimal and innovative use of resources, putting the quality at the center. I mean, you can get, as you sort of rightly pointed out, that at the end of the day, you will get not only, I mean, quality, but you will also get quantity. So I think that is my experience.